welcome to our AIHEC Health webinar series. For those who this is your first one, welcome. For some of you, I know that this is your second or third. This is our third in this series, with one occurring every week this month. So we're really excited for you to be here, to join us for the first or second or third time. And we're excited for you to continue to be involved with us as we move this series along into the fall and into the next year. My name is Maggie. I work with AIHEC. I'm the Health Initiatives Coordinator. So again, welcome. We're so excited. I'm going to pass it over to Reno Charette.
Hello, everyone. Like Maggie said, we're really happy that you've joined us today and that we hope you have a good relationship with our tribal colleges. And if you're just building that relationship, participating in the AIHEC projects is a good way to meet people. I'm really pleased today to be able to introduce two presenters that we have been working with for about a year now. I like that they're so enthusiastic about taking difficult concepts and explaining it so a historian like myself can understand the basics of how data is collected, stored, shared, and used in many other ways. So that's becoming a bigger issue in Indian country as we create programs to solve the problems for health and other issues in Indian country. So the two gentlemen today are going to help spread the word on how to manage data and what can be done with it. Dr. Alex Feltus is the co-founder of Praxis AI, and we've had an excellent working relationship with them to build online programming like the library Maggie talked about, and also some 10-week programs. So keep an eye on what we're doing. I think that you'll find items that you're interested in or you can share with others. We're also joined by Corey Smith from the University of North Dakota, and he is also involved in informatics and bioinformatics, and his perspective is fantastic on how it can be used by people at all levels with minimal education and just building on that throughout. I think that we have Tyler Parisian, who is a co-PI for our project. He's on the webinar today. He's a faculty member at Turtle Mountain Community College, and he also is interested in informatics. And we're all going to learn about hackathons. So enjoy the day, put things in the chat, and we'll watch for your comments. Go ahead, Corey.
I'm going to share my slides. Just hang on a second. Everybody see that okay?
No, not yet.
No, yeah, no slides.
No slides. Hang on. Let me, oh, there it is. How about now?
Yes.
Okay, great. So let me I'm going to back out here a second. Now. Okay. All right. Still up?
Yep.
Okay, great. Okay. So greetings, everyone. And thank you for that introduction, Reno. My name is Corey Smith, and I'm an assistant professor at the University of North Dakota School of Medicine and Health Sciences, as well as the team lead for the bioinformatics Birch team, which is a project that is that Dr. Feltus and Dr. Parisian and Reno and I are affiliated with out of AIHEC. And I've had the privilege of working with this group of collaborators at AIHEC for just a little bit over a year from the time we rolled up our shirt sleeves and started working on the grant. And it's really been quite a privilege for me. And when I'm not doing that, I'm either teaching health informatics to our health profession students at the University of North Dakota or conducting research in my own areas of interest. So as a member of the Birch bioinformatics team, our mission is to develop opportunities for students to and faculty to gain knowledge and skills and to be well versed in the science behind the use of data and the various technologies associated with the creation, storage, and then use of data to address problems in the health sciences. But I would add that just as important, it is our expectation that students will be able to engage critically on informatics topics that directly affect them and their communities through an Indigenous lens. So for example, data privacy and the ethical use of data is receiving a great deal of attention these days certainly by patients and researchers alike. And so, we are just on the cusp of really beginning to tackle some of these questions. So, for example, what is that? What does privacy mean for tribal communities? This has been a subject of significant focus and attention for a while. And so what we would like to do is take a renewed look at that or perspective. Where do these questions intersect with understandings, for example, of tribal sovereignty, as well as notions of, what is Indigenous data governance and what does that mean within a community context? We've been hearing a lot about artificial intelligence or AI in recent months, and like it or not, it's here to stay. But what would an Indigenous-centered set of guidelines for the development of AI systems look like? And how can AI better serve Indigenous communities? What might an Indigenous approach to the application of informatics and digital tools, to the development and application of informatics and digital tools, such as video games, virtual reality, and various apps that we all have on our phones, what would that look like? What would those look like if they were designed by and for Indigenous people? These are just a few of the really big questions that we plan to tackle in this course over the next, in this project over the next year or two, and webcasts just like this. But then there are other questions which are perhaps even more fundamental, like just defining terms and guiding principles. And so those are, some of the first steps that we plan to take. So these are only a few of the questions we are asking ourselves. There's a lot to unpack, but we're confident that we'll be able to benefit from your experience and insights as well. And we hope that that will inform this work. So today, I'm going to give you the 30,000-foot view of this field that we call informatics. So data have always mattered. Believe it or not, data have always played an important role in tribal communities. And there were plenty of folks around who were collecting data and record keeping centuries before there were guys like me and guys like Dr. Feltus. So although, originating in what was largely an oral tradition, the winter count is, I think, an excellent example of this. And what you see on this slide is a well-known winter count. So the winter count was a pictorial calendar or history in which tribes recorded, significant events. And a person had to be appointed to do this. This was a person that was designated by the Tioshbe or community to take on this task. It was a very important task. Events such as battles, weather events, epidemics, and astronomical events were recorded on various materials, not just on buffalo hides, as you see here, but also on cloth and paper. And the reason these were called winter counts is because the year that was recorded on the medium was believed to begin at the time of the first snowfall. I should mention that these types of recording systems are not unique to the Northern Plains. Other indigenous peoples have also developed systems of documentation as well. But they all have similar elements in common. So, for example, the use of various symbols or symbol systems to represent data and information. There's a mechanism or process that's been defined for recording the information on some medium for the storage, retrieval, and communication of that information over time, which you can imagine not only serves as a marker for the collective memory of a community, but can be useful in making decisions that affect the life of the community as well. So in a nutshell, that is informatics. That is informatics. So now if we fast forward to the advent of the modern healthcare enterprise in the 21st century, we encounter a much more highfalutin definition, which is the subject matter that those of us on the biomedical informatics team are concerned with. And this rather formal definition of biomedical informatics shown on this slide is one that happens to be put forward by the American Medical Informatics Association. And according to the American Medical Informatics Association, informatics is, it's a mouthful, the interdisciplinary field that studies and pursues the effective uses of biomedical data. Remember, data, which are nothing more than raw numbers or symbols, information, which amounts to data that's interpreted and given some kind of meaning within a prescribed context, and knowledge. And knowledge is information that is used to deepen an understanding of some phenomenon for the purpose of scientific inquiry, problem solving, and decision making, motivated by efforts to improve human health. So as a discipline, biomedical informatics is playing an increasingly critical role in health and healthcare. So as we all wrestle with the challenges of how we can take advantage of all of the data that I and the healthcare industry generate and consume on a daily basis, so that we can lead more healthy and fulfilled lives, this is really the challenge for us. From time to time, you may see variations of this definition but they all basically rely on the same elements, which include interdisciplinarity and the use of research methods and technologies to improve how data and information can be used more effectively to improve health and healthcare operations. So as you will notice in this slide, there are a number of specialties and even subspecialties within the field of health informatics. So those of us who call ourselves informaticians or informaticists are a pretty diverse group. So for example, the American Medical Informatics Association, which I mentioned earlier, has 22 different working groups, each representing a different set of interests within the field, professional interests. As a member of AMIA myself, I participate in 3 of the interest groups, which include mental health, consumer health, and public health, because my research interests straddle all those areas. The slide also communicates the fact that even with the diversity of interests and applications, informatics has a common knowledge base that informs each of the different domains. These areas of application range from the very smallest units of analysis at the molecular and cellular level for those who are bioinformaticians, all the way to entire populations at the right-hand side, the other end, which is the concern of public health informatics. Those of you who are participating in this webinar also represent a variety of academic interests. and may approach your interests in informatics from a variety of vantage points. So quickly, I'm just going to run through a few take-home observations from this slide that I would like to make. So first, as you can see by looking at the arrows, which all point inward, the field of health informatics draws its inspiration and content from a number of different disciplines, all encircling the box in the center. Secondly, what is implied here is that there are different pathways that professionals from these other disciplines often take to becoming interested in and becoming informaticians themselves. So for example, as an epidemiologist, I recognized early on that informatics had a lot to offer public health. So epidemiology, which is one of my professional homes, is a data and information intensive science. Informatics complemented my training as a public health professional by helping me to identify and seek more efficient ways to creating channels for the receipt and use of population-based data. And by the way, as we witnessed over the course of this horrible pandemic, the combined skill set of epidemiology and informatics brought a lot of value to the public's health. And then the third and final point I want to make is that informatics informaticians have access to an incredible storehouse of knowledge contributed by these other disciplines from which to draw when considering, designing, implementing, and evaluating information systems that contribute to this massive industry that we call healthcare these days. So it is our expectation that those of you who are able to join us today will take this journey with us into the future. So in summary, those of us working on the Narch Birch project believe that there's great potential for a more indigenized approach to informatics. So for example, informatics offers widely accepted methods and techniques used by researchers and the medical community for finding solutions using data for improved health and quality of life of tribal nations. Second, informatics can provide a vast array of powerful tools and technologies, not unlike the winter count, by the way, for telling the story of health and well-being in tribal communities. Informatics can equip tribal health organizations and tribal governments with standardized ways or approaches for collecting, managing, and using their own data for tribal program planning and evaluation, which ultimately paves the way for the future development of more innovative, effective, and affordable community-driven solutions for better health using data and health information technology. So thank you. You can get in touch with me if you wish. My email address is there. You can also direct message me in LinkedIn, and of course, you can always reach me by phone. So I'm going to turn it back over. I think, who's up next? I think Dr. Feltus, you are next on the agenda.
Yep, I can have the screen. I think you need to stop sharing, Corey.
Oh,
I think
let me go back.
All right, got it. Can you see that?
Yep.
All right, where is a little button? Hey, so my name's Alex Feltus. I'm a professor at Clemson University. I call myself a computational biologist, and we study plants and animals and try to understand how genes make them, be a beautiful, wonderful human, or maybe the genes go bad and a tumor arises, or we've worked with rice plants, mixing together the right genes to make rice produce higher yields under drought stress and things like that. So, but I'm really a biologist, and I'm also an educator. I've been teaching for a long time. I think I've been a professional scientist for about 30 years and probably been teaching, off and on the whole time, but as a professor about 16 or 17 years. So I've taught a lot of people. Let me see if I get this little thing to work here. 1 second. I guess another way of saying that is I've bored so many people, it's not even funny, right? In classrooms, like, I mean, snores and all that kind of stuff. Teaching technical stuff can be really difficult sometimes. But over the last few years, especially right before COVID, really, I started teaching a little bit differently. Instead of just standing in front of people, kind of like what we're doing right now, really, and just presenting information, I like to have people get together and work on interdisciplinary teams to solve problems, and everything's problem focused. And I do this a little bit in the classroom, but one of the really powerful things I've done, in which we're doing with the NIH Birch project, give you an example of this later, is a thing called a hackathon. And a hackathon is where really smart people get together and they try to solve a problem they care about. And when they solve the problem, they might learn some skills, learn some things that will help them in their careers and able to just, lives and careers, maybe their, jobs down the road. And so hackathons are very experiential things. And this is a definition of a hackathon. You might have heard of hackers. Probably everybody's heard of hackers, right? And sometimes hackers have a negative connotation. They are people that hack into, computers and steal money and stuff like that. But a hackathon is really what it is about, like, using computers to solve problems, like hacking through a problem, like just chipping it away until you have a solution. And it's usually like a really creative thing. So when you hear the word hackathon, this usually comes from like computer people, like computer science people. And I'm a biologist. I do a lot of computer science stuff, but fundamentally I'm a biologist. But this is a definition I pull off the internet. Is a hackathon is something where a company, like a tech company like Google or something, will get people together and try to like write software, write code to solve this problem. They usually do it in 24 hours. They don't sleep, stay up all night. There's a lot of sugar rushes going on and a lot of creativity. They're really fun things. But these are like these 24-hour quick, like hackathon, things. The idea here is to go from this, is sitting in a classroom or sitting and studying and doing something where you're active and working together and solving really complex problems. So it's like it's an experiential thing. It's much more, interactive than, getting together with people. We've taken the hackathon concept, which we'll be doing with the informatics training and solving problems. We'll talk more about this in a minute. With long-term hackathons. So a traditional computer science hackathon is like 24 hours. We're spreading it out over, we usually have a hackathon where you get together like 3 half days. I'll show you an example of this. But then we can keep going afterwards. So if you start to really find something cool, you start to learn something neat, then you can go and keep learning it or keep trying to solve the problem and do the research. So I wanted to just give a slide here to kind of show you what I mean by like the actual process of a hackathon. And this might be a bit dry, but I think it's pretty important to kind of see what I'm talking about. But so the first thing you do in a hackathon is you have a problem. You take a person who's a motivated person, somebody who's interested in something, somebody who's passionate about something, and you get that person to bring a question to the hackathon. And we're going to have, Tyler's going to lead a discussion in a little bit, talk about some problems that you want to solve. You might want to be a lead motivated person to lead a hackathon, but there's a person that brings a question together to the group. And then what you do is, once you have the question, a lot of times when you're trying to solve a problem, especially complex stuff, you got to have some training for it, right? And so what we do is we have this online platform, which I'll show you, where you can go and you can learn from the platform. If you've been in the Austin Institute, you've already used the platform that I'm talking about. But you have some training in there, like maybe you need to learn a little bit of statistics. Maybe you need to learn like a little bit about where's data to cure cancer, like, and be able to get that stuff in a computational environment and being able to solve problems. So what we do is in a hackathon is we give skills. We have some material you can go through at a self-pace and learn what you need to know to kind of get up to speed for the hackathon. Once we have this. We have everybody's sort of ready. We all get together, and typically we do a 1 half day hackathon. Usually it's like a Friday, Saturday, and Sunday afternoons. And I'll explain, you don't have to be there the whole time. But you start doing research. You've got a problem and you got the skills to work on it. And maybe you just got started with the skills, but you can work together to help each other out. So you get together and you form teams, you talk about what the problem you're trying to solve and start hacking together. And typically, you form like a group of people and you go off on your own and do your thing. If you do this physically, go outside, talk about it. If you're doing this virtually, you can go off into a little room in a virtual environment and work together. After the hackathon, this is something really different, is that research takes a long time. I've been doing professional science research for 30 years. Sometimes it takes, a month. Sometimes it takes 2 weeks. Sometimes it takes, I've got projects I've been working on for 30 years trying to figure them out. But we always try to do this deep dive thing. Once you get started, really trying to go and get deep into the problem and solving the problem. Along the way, you're learning skills, you're learning workforce skills and what we're doing, so that you actually have something that you can prove with a digital badge that you can show an employer, hey, I know how to do this stuff, right? Like you have transcript grades at your university or college. You also have, digital badges to kind of prove that you have skills. You can actually do something, right? It's like, I know how to drive a car, but I don't know how to fix it. If I knew how to fix the engine, then, I could actually have that skill and be badged for it. So diving deep into the research. And then if we're trying to do is, like, after people get really, really excited about something, they want to kind of come and go and do a research project, kind of having this open virtual lab with people and really creating products, like writing a scientific publication. If you're writing software, publishing your software, you're getting those digital badges. And really that's sort of the product of what these hackathons are. So it's really about getting together and solving it. This is an example of a hackathon that we did back in January, I believe, of this year. And this is still ongoing. I'll talk about it in a second. But this is a project where we met a person, Dr. Shivani Gupta, and she's a really interesting person. She's interested in Ayurvedic medicine, which is like in Indian subcontinent, Asia, South Asia, medicinal approaches, holistic approaches to being able to, through nutrition and yoga and things like that, be able to, for healing or making yourself a healthier, happier person, right? And healing disease and things like that. So we met this person and she's really cool. And she does this Ayurvedic medicine thing. And she's got a company where she sells little, pills that have the Ayurvedic things in there, like things like turmeric, which is found in curry, like this little yellow powder. And we thought, how could we get together and what kind of problems does she want to solve? And she was interested in like making better Ayurvedic products so people can get healthier. And I'm interested in like how like things that you put in your body, how they interact with your genes and how they affect your genetics and make it where you can actually, be healthier, right? So for example, like she gives people a turmeric powder that has a little molecule called curcumin in it. And it will do things like reduce inflammation. So we're really like focusing on things like osteoarthritis in your knees and things like that. And how does it actually work in your body, right? And this is a very much a medical, biomedical informatics kind of problem in humans. So she's really excited about this. I'm really excited about understanding biochemistry and how these small molecules work in your body. So we got together and we said, okay, why don't we come up with this question and get some people together that from different backgrounds and see if we can solve the problem. So the question was, what genes does this chemical curcumin, it's just a little molecule that's inside the turmeric powder, right? What does it stick to in your body? What products of your genes? And so this is a very advanced question, but also really, really kind of a straightforward thing. Dr. Gupta doesn't know anything about knows very little about biochemistry. So she kind of came to the hackathon and learned a lot of biochemistry, the person who was running it. We had several teams. We had about 25 people get together in the hackathon, and they formed teams and they started saying, well, let's try to understand how this molecule, what's happening inside your body when you eat this compound, what genes is it affecting? And really like, how is it working as a drug? Just like, you take ibuprofen, it goes in your body and sticks to different parts, different gene products in your body, and your fever goes away, your headache goes away. Same thing here. This little molecule goes in your body, goes throughout your blood, starts touching gene products in your body, proteins, and then it goes and makes inflammation go away over time. And so we're trying to understand what's happening with that. And so we had all the students before the hackers come, we had a pre-skilling thing where we gave them some skills on finding data. Like, where do you find gene data? Where do you find like data where you can find the molecules and stuff like that, right? And we gave it to them in our platform so they could get some training. We got together in January. There were several teams. I think 3 teams were formed. And the teams decided at the hackathon, they're like, hey, I want to see how this works in cancer. I want to see how this works in cardiovascular disease. I want to see how this works in Alzheimer's. And also we're looking at this in osteoarthritis too. I was kind of in the background sort of doing that. After the hackathon was over, and this is a 3 half-day event, then after a week, I asked everybody the 25 people, hey, who wants to come back and keep working on it? Who wants to continue to do research? Just like I would do in my lab at Clemson, where people are getting trained with masters and PhDs, the same stuff. And so a few people came back, and we're still meeting to this day. And right now, we're actually, one of the hackers has written some software. They learned how to do Python programming. They're using that to find a job right now. They didn't have that skill before, and now they do. And then I'm helping them, mentoring them. Other people are mentoring them on how to get better at programming, better at workforce development, workforce skills. And they're publishing a paper, right, from this process. So it's a little bit different than walking into a classroom, taking some courses, getting a grade, and leaving. This is about getting together and hacking and solving a problem. What we're going to do, we're going to have a hackathon. I'll show you here's the code for this actually. We're going to have a hackathon on August 18th through the 20th. And what we're going to do with this is we're going to get some people together, and we're going to say, okay, what is it that you put in your body? Like, what's on when you drink a Red Bull, what are the ingredients in Red Bull? If you eat a bag of Funyuns, what's in the Funyuns? If you eat a dish that your family has always prepared, what is it in those things, in the thing that you're putting in your body? What are the ingredients? What are the chemicals? How do they stick to your body? So that's really what the hackathon's all about. And it's not about computer programming or anything like that. You could if you wanted to, but it's really about just learning how things go in your body, how they affect your body, and learning some of the databases that you use, some of the tools that I use. Again, like been doing this for 30 years in my biological studies of plants and animals, the same kind of thing. In this hackathon, we're going to learn about indigenous research methods, informatics, like Dr. Smith was just talking about. This is really about nutritional genomics. Genomics is your DNA, like how your DNA works and how these nutritional things go into your body. And I guess, if you start talking about like Red Bull, I'm not so sure that's nutrition, but it definitely has an effect on your body, right? And how that works, right? And a little bit about genes and cells, kind of just like a easy entry into like how you do biomedical studies, and like, what is it, framing a question, and then how deep can you dive to be able to do that? You'll lose on teams, and there'll always be mentors around helping you out, trying to make sure you understand, or helping you out, just kind of teaching you on the fly, as opposed to like a long-term semester training or whatever. I wanted to show you real quick the platform that we do this in, if I can. So right now I'm sitting on a computer. I'm in South Carolina. I'm on my laptop, and I'm looking at, I'm on a web browser right now. Like, this is where you go and you want to search for Google stuff or whatever. And this is our courses. We have all these courses here and some of these, there's the Austinet Institute are here, and a lot of courses I teach at my university. And what we'll do is we'll have the hackathon in here. I'm going to show you that turmeric hackathon that we did back in January. So to participate in the hackathon virtually, you just get on a laptop, a computer. You can do it on your phone if you've got good eyes. I'm old, I can't see those little things anymore. But so this is the material for a hackathon. And what is you have training, like there'll be training in here for like data sets. Like these are training on how to go to a database on the internet and find the molecules that are inside Red Bull, the molecules that are inside of a potato, the molecules that are inside of turmeric, a spice that you might use, right? And you can go through and find information about that, all the way down to like, how does it affect your body? Like, does it give you disease? Does it cure disease? These databases are really powerful. I always tell my students that the cure for cancer is sitting in these databases. This might just got to figure out how to connect the dots, and it could be you. And we'll probably have a little bit of in this hackathon, we actually taught people how to use computers like remotely, like how to do a little bit of basic programming. And programming is, if you've done algebra, you can do programming, right? And if you were bad at algebra, you didn't like it, you might like programming. It's a really cool way of communicating with data, trying to understand how things work. I think it's the nerdiest thing I've ever said. And also like how to publish things when you find it, right? How you write scientific reports. These are things that I do in, as a professor in my lab, and we're teaching some of that. And we'll also in here have the hackathon, how you actually, do the hackathon and what the question is. Once we have teams, we'll form, they'll get together and you'll give a presentation, and we'll film you, right? Or record the session and put it into this platform so you can go back and look at what the other teams did and do some learning and all that kind of stuff. And in this hackathon, there's mentors, human mentors, which humans are number one, but we also have artificial intelligence assistant. We actually have we'll be creating one assistant we're going to call Priya Rainbow, I believe, which is going to be an indigenized AI assistant that's going to answer questions from an indigenous research perspective, which is going to be really cool to do that. But this is a tool where you kind of like a Google search, you go and ask it questions, and it gives you answers for it. So I'm going to stop there, and I want to pass it over to Tyler. And Tyler, if we could just sort of, ask in chat, or, people can unmute and sort of talk about it. What's a problem you'd want to solve if you had a hackathon? If you had a research lab, all of a sudden walk in your front door, if research scientists to help you, what would you want to solve, and what kind of data you would need to solve this? And I'm going to stop sharing.
Okay. So I think Dr. Alex wants us to essentially try to talk about some problems that Native Americans face today. So one of the things that I wanted to do was just draw some attention to some of the studies that we're doing at TMCC, or that I'm involved with, and maybe get the ball rolling for some examples from everybody else. So currently I'm helping oversee the students with Dr. Lyle Best. He has a genetics and preeclampsia study at TMCC. And what we do there essentially is that the students collect samples and test those samples for genetic variations that may possibly have linkages to preeclampsia. I'm also working on a study with Dr. Melanie Nadu out of the University of North Dakota. And that study is focused more around cancer and youth, Native American youth, who I guess to see what the risk factors and protective factors that essentially lead to cancer and what the youth can possibly do. With her study, she was looking at the youth risk behavioral surveillance system, which monitors health behavioral risk in the youth. That tool is not culturally centered, and it's not necessarily designed specifically for Native American communities. So the research that we're doing right now is we're interviewing different community stakeholders, and we're trying to get their opinions on what risk factors our Native youth are taking part in, and what protective factors are out there, so that we could create a more community specific, tribal community specific tool. But there's a lot of, those are just some examples of problems that other researchers have, I guess, questioned and are researching. So Dr. Melanie Nadu's research focuses around cancer. Dr. Best focuses around preeclampsia. But in Native American communities, there's a lot of other health disparities that we can discuss. Native Americans have a shorter life expectancy than the rest of the United States population. Some of that can be contributed to things like higher rate of chronic liver disease, cirrhosis, diabetes, self-injury and suicide, respiratory disease. So these are some of the health disparities that we know affect the Native American population. But I guess at this point, Dr. Feltus wants me to ask you who are participating today, if you have any other problems or questions you want. or you think about, I guess, that affect Native American people? So if anybody would like to share in the chat, or maybe turn on your mic and discuss some problems.
I have one. This is Rita. Today, when in tribal health programs, they address diabetes as so prevalent within communities. They also support the traditional diet, buffalo and berries and wild roots that our tribes harvested. With it being so difficult to get buffalo for tribal governments to have their own herds, drawing from those on farm. There's in the marketplace, when you go to buy buffalo from the grocery store, it might not always be 100% buffalo, but it is a product. It is a product of crossbreeding cattle. So how long could you do that? Keep crossbreeding until your result of this crossbred animal that you're eating no longer possesses the health benefit for an indigenous diet to respond as a response to diabetes and making a person better. Did you get all that, or was my microphone messed up?
Your internet was cutting in and out.
Oh. Well, essentially,
We understood.
Okay, you understood. Great. Thank you.
What is somebody else, like, what the problem that you care about? Like, I always I kissed my dad on the forehead about a week before he died of lung cancer, and so I want to solve lung cancer, and the way to do that is to learn how to do informatics, right? And so things like that.
Looks like Joel has his hand up.
Can everybody hear me all right? I guess this might be a bigger question. It's not specific to a particular problem. I mean, it is, but something that I've always worried about and concerned about being a statistician and a quantitative person is, you know, we have this deluge of data now with big data and, you know, nationally and globally available data sets. And I think more than anything, you know, there's that old adage that we can't measure what counts, so we count what we can measure. And I would like to really focus on, you know, some kind of practical means of identifying, you know, spurious relations, you know, where it looks like things are causally related, but there's some missing variable there, or there's some intermediary, you know, mediating variable that's kind of resulting in the causal relation, or, you know, A causes B relationship is really because of some other factor C that's going on. You know, it might be, you know, we talk about, you know, median lifetimes of Indigenous people being much shorter, and that's due to, you know, like chronic liver disease or cerebrovascular problems or something like that. But what are the parts that we're missing in those data sets that we can at least somewhat triangulate in on and see, is this a function of food deserts? Is this a function of, you know, cultural hesitancy around screening? Like, what are the things that we can identify in the data that need more research? I don't know if that's a necessarily easy one to tackle. I mean, I've been doing this stuff for a long time, and spurious relations are always hard to find, and I worry that they're becoming far more common with big data, you know, and there's a point at which I think we need to work on methods to identify true relations and truly actionable information for our communities versus, you know, falling down a rabbit hole and you know, investing a bunch of time and effort into things that that might be caused by something else or might be treated by something else. So that's kind of my stance on all of this, and I don't know how we could go about organizing that, but those are my thoughts. Thank you.
Tyler, do you mind if I'm going to comment on that? So what you're talking about, I understand what you're saying, and I see this too. I look at huge data sets, and I see, what you can take 150 genes, and they're associated with anything. Everything's so interconnected, right? It's holistic. But what I'm hearing you saying is that you're talking about a very important technical thing. And what I would do is I'm going to say that what you're talking about is how would you approach a problem with that in mind? That's a problem that a specific problem you're trying to solve. Like, let's just throw, a renal cell carcinoma, kidney cancer, right? So you have a thing you're trying to understand. So the task of the hackathon might be like, what causes kidney cancer in Native American communities, right? Because there's a higher incidence of it. What is it that's doing that? And then you might have a team, and then that's sort of your technical interest that brings together your team and maybe helps focus your team to solve the problem. And then the other team is solving the problem in a different way. And the other ones, and they might solve the problem, and you might be like, well, they're finding spurious associations. And then there's a point there where you get to really talk about it, right? And then if it's like, all of a sudden a little connection starts to form between your ideas and some other team, or maybe within your team, well, maybe that's a research thing that, you can continue on in the next hackathon, or maybe you pull off 3 or 4 people, like-minded people, and start studying it. And maybe there's a 19-year-old person that was on your team that wants to learn programming and try to understand what you're saying. And so, sort of naturally building that excitement. So what I'm hearing you say is like, that's a technical thing you're trying to solve, but I always would want to put it into the context of something that's of interest, to everybody, with lots of different slices, technical slices or perspectives on digging into the problem. Does that make any sense? I think.
Yeah, I think absolutely on a particular problem. I think what I was thinking is, taking a hackathon and maybe focusing it where you have a data set, and then you poke holes in the data set. You know what I mean? You take out kind of important key indicators and try and task the group with, all right, see if you can identify if these relations are spurious or not, and try and come up with techniques through which, maybe it's through over investigation of residuals, or, some structure of other things, or, prediction confidences, or whatever it is, but help people understand from the get-go that, again, we can't always measure what counts, so we count what we can measure, sort of things, and understand that, the insights that you might be able to glean from the BRFIS may just completely gloss over these regional kind of specific issues, and at least being alert and aware of the fact that those relations may be spurious, and you might need to do that kind of quantitative iteration to identify those factors. But yeah, I see what you're saying. I'm probably thinking way too ambitiously about what hackathons can reasonably accomplish. But I think there is something to say about helping people not only become familiar with data, but understand the limits and the necessity for iterations on data.
Sure.
We see this with like cross-cultural translations of measures and stuff like that as well. So I think, that's all I was getting at. Sorry, this is kind of my hill to die on, I suppose.
What you're saying is absolutely excellent, but it's the way, I guess I'm going to be explicit about what I was trying to get at. It'll scare everybody away. If that's your hackathon, they won't go. And we've done time series hackathons where nobody showed up. I invited hundreds of people and nobody showed up. So you have to do something that's a little more grounded, something that a problem people can wrap their brains around, and then go down that, like a rabbit hole, like you're talking about, and find something in that rabbit hole, right? That's a good way of doing it. So I'm not discounting what you're saying. I'm just saying, like, from a recruitment perspective, to get people to want to learn.
Might be a high bar. Gotcha.
Yeah, that bar fits perfectly inside the hackathon, just not the way it started. My opinion, sorry. Does anybody else on the call like that have something that they've always been curious about and they've never had time or expertise to try to figure it out?
So I would say one thing that I've been curious about, I worked on another grant that supported all adult vaccinations, but specifically it was brought about with COVID vaccination. And we found that there was American Indian, Alaska Native people were more than twice as likely to contact COVID-19. So just what is the relationship? You know, why is that? Is it a matter of not getting vaccinated? Is it a matter of some sort of component within the gene makeup? You know, why is that? And then as just like a lengthier thing, I would be curious if there was some correlation between other types of things that people can get vaccinated for, and maybe Native people having a higher incident of contacting those things as well.
That's an excellent. I mean, that's you know, there's a lot of excellent ideas here. That one would be something you could do. That's where like somebody like Corey and I'm speaking for you, Dr. Smith, that come in and like we know where those databases are, you know, and most people don't. That's why you go to school, right, to learn stuff like that, and you go get the databases, and you find out in the databases, well, there's very low representation of Native American in the databases, and so are there other databases? Maybe there's not, and then you're like, well, maybe we need to go make that data. Maybe, you know, to solve the problem, you know, and getting a little bit scientific on it and trying to, you know, have a hypothesis and test it and stuff like that. Very doable.
And I would
So
say, go ahead.
if I can just say my 2 cents, waka maya runga, erusara runga, kipakluga runga, kaganaka runga, mangyaka runga. I'm Yupik and Supik from the Lower Yukon in Alaska at the Bering Sea. And I keep hearing you talk about all this data, and you keep looking at this data, and you keep looking at this data from one perspective. And one of the things, I'm a research associate at ANTHC, and I'm still a student. My son is a leukemia and a bone marrow transplant patient. So I've looked at that world from various different angles, specifically from the biological perspective, but I also am Yupik and Supik in my heart. So I looked at his outcome that started 9 years ago. We've been in this world. I looked at his outcome and knew what outcome I wanted for him. As a Yupik and a Supik mother. And so everything in this world, I made certain to attach to him because of that. It was my perspective. It was my worldview. I knew that there was data behind his diagnoses, but I knew I had to insert my perspective in every step of his being, every step of his process, and then kind of attach myself to him in that manner. So I just felt like this long arm of him to ensure his survival. As a pediatric adolescent Indigenous boy, his chances were not very good. He is out and walking still in this world. So I consider that a huge a benefit for us to see, for us to, you know, be able to still walk in this world and have that worldview. So I guess my point would be your perspective is flawed if you're looking at this paper and looking at it from that angle, no matter what kind of expertise you might hold in data and data research, your perspective is not changing. You do not have that Indigenous worldview there, but you keep looking at it and expecting that. Let me give you an example. I've worked with I'm so new here to the research world that there was a guy who wanted to write a paper on co-production of knowledge. But he was looking at me the way that I was reading his paper. He was looking at me with binoculars and saying, okay, I see her doing this, and I see her doing this, without even coming up and approaching me, without looking at it from my perspective. So he was sitting away like, so I'm giving you how I felt, right? I felt like he was this peeping Tom looking at me with binoculars on. And it kind of peeved me that he wasn't willing to come and sit by me and look at me from my perspective. But going back to my son and his treatment, that's the kind of perspective I'm talking about. I had to know, me being a Yupik and a Supik was gonna be the ultimate outcome, was that he would still reside and walk on this planet. That's just my 2 cents, but I keep hearing that same dialogue, and it's going around and around and around in circles. You need to change your perspective. And if you're looking at Indigenous data sets, you need to look at from their perspective as well.
Excellent. You're the perfect person to lead a hackathon. You have expertise I do not have, and you have motivation from leukemia. I'm glad that your son is still walking. That that's exactly what this is all about. Not about like, here's a way to teach informatics. Everybody has to do it this way. It's about doing it differently and doing it in a creative way. And what you're saying is the best thing I've heard in years. Thank you for saying that. If you want to lead a hackathon, I'm going to put my email. If you want to participate in one, lead with a question. Let me know.
I have a lot, but we're just emerging out from this leukemia and bone marrow transplant world that is filled with trauma. So
Sure.
yeah, I appreciate that.
Yeah, that's where, like, you know, you're coming. Yeah, you're like, come here, here's the problem. Don't do it this way. Let's do it a different way. And then then you know, the last I checked, people are still getting cancer, so we're not doing it right.
Yeah.
So I know I'm going to go ahead. I think Maggie, I put up a couple of QR codes for the a survey that we have for the webinar. If you want to take a picture of this, I guess you could do it from recording. And I put in chat the link, and there's also the registration for the hackathon. The hackathon is going to be next Friday, Saturday, and Sunday from 1 to 5 p.m. Eastern. And then if you come the first day, you can be part of it. You don't have to come on Saturday. You just work with your team, and we'll have team presentations on Sunday. And so if you're interested in this, please register. You can just come and be a fly on the wall. You don't have to form a team. Just come by and see what we're doing.
I just wanted to mention that Krista had a question she posted in the chat, and I don't know, I'd be happy to stay longer, or Krista, if you and I could, if you want to chat, maybe by email or phone, we can do that as well.
Dr. Smith, I think if you want to speak to it in the next few minutes, you could do that. And then, you know, those who need to hop off can certainly hop off.
Sure, yeah. So let me see, your question. Can you repeat your question for the benefit of those who are still on?
Sure. So I work for the Turtle Mountain Public Health Department as administrative support specialist. And we're looking at real-time data. I know this has nothing to do with the hackathon, but one of our issues is trying to come up with solutions on how to get the real-time data so we could address public health issues in our community. And right now, so we kind of put IHS on the back burner, and we're tackling getting information through the state, and we got data sharing agreements in the process, but we keep getting roadblocks or delayed or excuse after excuse. And so on the level that I'm talking about, yes, have been working with GTEC and also other areas and on the state level. But I'm just curious to know, in your research, are you going to get the results that you truly need regarding an Indigenous community if you don't get IHS to share their data? That's going to be a barrier if you're looking into a tribal community. So that's why I pose the question.
Yeah, so I would just say that you're not alone. That has been an issue for many of the tribes across the country. I guess I would point to folks that have been successful, and one of those is actually at the University of North Dakota. It's actually a member of your tribe, and that's Dr. Nadeau. She's been through that process. She had to write her dissertation using IHS data, and she would probably be the best resource that comes to mind right away. Also, Dr. Best. He and I have spoken over the years about some of the challenges of gaining access to tribal data. So he would be another, and they're both, I mean, she's a member of the tribe, and then Dr. Best is at the college. And so perhaps he could be of assistance in sort of pointing you or helping shepherd you through the process, because it really is a process, as you probably already know. So those are a couple of suggestions. So I would start with those who are in the know, who've already identified some of the barriers and some of the challenges, but have also experienced success. I don't know if that's helpful at all, but those are my suggestions.
It is. Who's the one from UND, the female that you said?
Dr. Melanie Nadeau,
Oh, Dr. Nadeau. Okay.
NADEAU.
Okay.
She's the chair of the Indigenous Health Program.
Yep. I know who she is.
Yep.
Thanks.
Yeah. Good question.
Okay, well, if there are no more questions, and if there are, please definitely reach out to Dr. Corey Smith, Dr. Alex Feltus, myself, Reno, anyone on our team. And if we're not the right person, we'll get you to the right person.